autism diagnoses have been happening a lot more lately, right? We've seen a lot higher prevalence of autism, and there's lots of theories about why. It could simply be that people are starting to notice it more. The other thing that happened is we saw the autism spectrum broadened significantly in terms of what met the definition for autism when the DSM-5 was released. The DSM is a diagnostic criteria book published by the American Psychological Association that basically decides, what are mental health issues and what are not mental health issues, and what are insurance companies expected to cover treatment for. And autism in that situation expanded quite a bit. When I work with friends in the education world, they treat an autism diagnosis relatively casually. They don't worry too much about it. For them, what it means is their student gets access to a bunch more funding and a lot more assistance and can be more successful. So for them, it's something they view as overall a positive thing. And so I think the broadening of the diagnostic criteria was probably quite helpful from an education perspective. I do get questions with some regularity about clients that we have here in the treatment center and whether or not they're autistic and what qualifies as autism and what doesn't. So I wanted to talk briefly about the differences and overlap, actually, in terms of autism and trauma. So one of the things that we understand about trauma and PTSD, one of the confusing parts about PTSD is it's not necessarily a causal outcome. And what that means is if I have the exact same external circumstances happen to two people, or very, very similar happen to two people, those two people might have a different response. And in war, for example, it's quite frequent. So you'll have examples where people will go through the same set of battles together. They'll be in the same platoon or the same group, same company. They'll go through the same set of battles. They'll lose the same friends. They'll be in the same foxholes. They go through ultimately the same amount of adversity. One comes home and struggles with nightmares or challenges or things that they wish they could forget. The other comes home and ends up pushing the grocery cart outside for the rest of their life. And that's they're homeless and they're schizophrenic and PTSD is so bad they can't function in the world. So back to the question, what's the difference? And the answer ultimately is we have no idea. However, there are some really interesting theories about what the difference might be. My favorite theory has to do with this idea called resiliency. Okay? Resiliency. And resiliency is loosely related to attachment theory. So attachment theory takes for granted the idea that human beings require a certain degree of attention, particularly really early in life, in order for things like identity formation and the formation of a concept of self and the ability to be safe and feel secure in their relationships in general, particularly in their relationships with other people later on. In reality, according to some variations of attachment theory, from 0 to 9 months, okay, I'm really just forming a sense of I. And then from 9 to 18 months, we're getting a sense of I am, aka in this space, I'm aware of existence. In this space, I'm starting to individuate in terms of my existence awareness from my primary caregivers. Often, traditionally, been the mother. Okay, now it's a variety of people at times. When I have inconsistent or neglectful caregivers here, the attachment system doesn't necessarily come on board. Now, what do we mean by the attachment system? Well, one of the crucial elements of the attachment system is the process of regulation. And we're really talking about central nervous system, not central nervous system. We're talking about nervous system regulation to some degree. From 0 to 9 months, infants don't have the capacity to down-regulate. So it's a really important concept to understand, right? So down-regulation, I am really upset with somebody, right? I get really upset with Brian. He's coming in, making a bunch of noise, causing trouble, right? I'm really, really mad about it. And I can sit here and be frustrated about it, but if I sit long enough, what will happen? Anybody ever get really mad at someone you love, and then after about 45 minutes at least, sometimes a couple of days, sometimes longer, you're able to settle down. Time heals all wounds and all this other stuff, right? There's this idea that I can down-regulate, okay? Down-regulation, And what I'm talking about specifically here is auto-regulation. I'm able to regulate myself to some degree, more or less, in the context of being angry or upset. Well, that's not something that happens out of the womb. Out of the womb, an infant cannot auto-regulate. The only way an infant can settle down is with the regulation of a primary caregiver. If you've ever been in an environment where a kid gets into real distress in a public setting, I've seen it a couple of different times. I can remember one time being at a restaurant and a kid fell down and got hurt. Now that's different than a kid complaining at a restaurant or being upset or being pissed off. There's a different cry, right? Kid fell down and got injured. And there was a very specific cry, and every head, but particularly the maternal heads in the room, instantly oriented to that kid. It is like, as human beings, we are locked into that kid. Okay? There is an understanding, I am in distress, I need help, and that distress will be regulated. One of the challenges we had in the 1920s, to get a little historical, in the 1920s, 1940s, I think actually, it might have been, gal came out named Dr. Spock. Dr. Spock, I think, was Freudian. If I don't remember what her orientation was, but she's a behaviorist. God bless the behaviorists. They think we're just basically machines. It's great fun. And it was, in that era, we were just getting into all the Henry Ford supply chain thing, building machines, and we're like, oh, maybe we're machines. Very fun. And so one of the things we decided is, you really probably don't want to attend to a crying baby because it'll spoil them. It'll habituate them to try to get your attention. It'll habituate them to have somebody else take care of them instead of taking care of themselves. I believe this did a significant amount of damage. It's really, really challenging to not attend to a crying infant because a crying infant only has one way of getting their needs met. And at a core level, one of the biggest questions we're asking ourselves every day, all the time, is, am I safe? If I'm not safe, the nervous system has to fire up the fight-flight response, right? Because I need to go get safe. So an infant is constantly assessing their level of safety, but infants ultimately are really, really, really not safe. They can't walk. They can't talk. They just kind of lay there. They're really not safe at all. Everybody else, most of the time, when something gets born, it has some level of capacity to be protected. And a human infant really doesn't. So the answer is ultimately no, unless I have a consistent and reliable caregiver. When I have a consistent and reliable caregiver, I will learn to downregulate from that caregiver through a process called co-regulation. Okay, so I'll interact with the baby's upset, I'll interact with the baby, ooh, it's okay, blah, 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 tappy, tappy, tap, love, snuggle. The baby calms down, often, not always, but hopefully eventually the baby settles down. And there's a series of other interactions that the infant can have as far as connection and disconnection. And we're going to get pretty far into the attachment theory if we really analyze that. For our purposes, when we're talking about autism and connection, there does seem to be a connection between some forms of autism. When I say this is a strong proviso. Not all forms of autism. I'm not an autism expert by any stretch of the imagination, but I have read a fair amount of literature that does seem to indicate that at times a really significant lack in co-regulation in infancy can contribute to the experience of autism. The other thing that you'll see here is one of the things I'll ask clients at times is, what do you remember about your birth? And obviously most people don't remember anything about their birth. But the question really is, what have you been told? Okay. Oh, my mom's labor was 45 hours long. Okay. That's pretty rough on everybody. Okay. Oh, well, mom came in, had me, and came home and took a nap, and then got up and went to work. Oh, all right. Well, that wasn't obviously a really severe labor experience. But birth trauma and some of the challenges that can happen in that setting can contribute quite a bit to this piece. And there's a lot of, that's a whole field in and of itself, and that you can get into as far as really understanding how that works. When we're talking about autism, some of the traits that we're talking about that were mentioned have been mentioned before: sensitivity, to stimuli. And there's all kinds of different stimuli we can be oversensitive to or overly sensitive to. You can be overly sensitive to light. You can be overly sensitive to temperature. You can be overly sensitive to sound. That's a big one. Yeah, touch, texture, all basically any of the five senses. One way it's been described to me is autism is like the capacity to filter out stimulus is limited in some respect. That's at least sort of one form or one aspect or one element of autism. And that, again, would be pretty consistent with co-regulation. The nervous system regulation is impeded with lack of a primary caregiver, and as a result, the capacity to create a filter is diminished in some respect. Now, I'm also relatively confident that this is very frequently a biological experience too, and that's what the common wisdom has been up to this point, that autism folks are born, not made, so to speak. But if I have a client who says, Greg, do you think I'm autistic? One of the things I'm going to talk about is, what do we know about your mom and your mom's relationship with you, particularly in the first 9 months of life? And if we have a compromised maternal situation, I'm going to lean toward that over necessarily a traditional autism diagnosis. And an autism diagnosis may also be pretty appropriate, but I'll take a look at some of Stephen Porges's work with the Safe and Sound protocol and some of that material that's just emerging right now. Again, the treatment of autism, so far it hasn't been treatable, right? It's just been a thing, and then we're done. Now, Porges has developed some really interesting things talking about treatment of autism that we can work with.
So do you think that it can go back to pregnant?
Oh, there's a whole, so the question was, Greg, can it go back to pregnancy? And yeah, there's a whole field of folks and therapists who work with in utero trauma and with birth trauma. And I always thought that stuff was super flaky. I imagined a bunch of people, dancing around a maypole and doing all kinds of, just kind of new agey, like blah, blah, blah. Well, as usual, the theory precedes the science. So that's one of the things that makes it really difficult. If you're a skeptic, for example, you're going to be skeptical. Good news is you won't be suckered. The bad news is you're most likely going to miss something that's correct, because theory always precedes science. And so these folks have been talking about in utero trauma and birth trauma. They appear to have something. There appears to really be something to that. Treatment of it is generally done with a lot of visualization. There is a whole field in the somatic experiencing world of touch work, and they tend to take 6 months to a year to see a lot of progress. But I have sent some clients to touch work oriented people who have a lot of that trauma, and their nervous system does tend to re-regulate. I wouldn't say they've sort of cured autism in most situations. What we do see is a reduction in symptoms some of the time. So, but that's progress compared to the alternative, right?
So what you're saying is you sent me there because you thought I was autistic.
No, good question. But I did think there was something there, but I don't see you as autistic at all. So that's the autism versus trauma. When I have the resiliency thing is going to be a significant challenge. These folks are usually going to present as what's called global high activation. That is to say, their nervous system is on full throttle freeze and full throttle fight flight at the same time. And they'll generally present as highly, highly dissociated. I see two variations with regularity. One variation is highly spiritual. And these folks actually will have, sometimes they'll have unexplainable phenomena that they're able to access. It's really interesting clinically to see. In the beginning, I was very skeptical of such things, but having watched it for many years, I feel like there might be something to it. And then the other variation is highly, highly intellectual. So very much in my head and not in my body. And those are the two variations that we see most often when somebody has this particular challenges in this particular zone with a primary caregiver. And that's regardless of whether they show up in this category. Sometimes they're able to function in a way that looks very, very normal in the world and don't have any questions about autism or some of that stuff. You joking?